We're having this meeting to highlight a very unique case. This was a 27-year-old lady who presented to us with something called acute liver failure. That means a patient whose liver is previously normal, suddenly the liver fails due to some acute infection. In this case, she also had something called DILI, drug-induced liver injury, because of unnecessary use of native medicine. Patient went into coma, and by the time she came to our hospital, she was already in coma for about a week. And once the patient came, she was so sick that we had to be put on ventilator. So acute liver failure is an indication for transplant, frequently done, but in this case the challenges were patient had already been in coma for 2 weeks before transplant, patient was on ventilator, patient had evidence of infection with low BP. So with all these factors, the risk of transplant is very, very high. It's almost 50% is the mortality rate. But in this case, after discussing with the family, we took up the challenge, and the entire team, with the combined efforts of our entire team, the liver ICU team, the hepatologists, the transplant surgeons, the transplant anesthetists, together we could do this really difficult, challenging transplant. And the beauty of it is, once we did the liver transplant, within 6 hours the patient woke up, and within 3 days the patient was walking around, and within 10 days the patient is she's ready to go home. So this just highlights, there's two things we need to highlight. One is that, in patients with jaundice, unnecessary use of native medicine. Once you have jaundice, you should go to a specialist and get the correct treatment, and you should be patient, because sometimes it takes time. Unnecessary use of native medicine will make things much worse. And the other thing is, in acute liver failure, referring a patient promptly is very important. In this case, she was referred quite late, but luckily, because of the good efforts of our team and a really good recovery, we could salvage her. But a really good referral system, and the patient with acute liver failure, we should be referred on time to a specialist center, and we should go for a transplant at the ideal time. The procedure is living donor liver transplantation done for acute liver failure of drug-induced liver injury.